Dr. Omer, I think picking up from that point that Dr. Munir talked about, especially when we're talking about the coronavirus. Now, as I mentioned before, we've been seeing a number of such viruses, for example, swine flu, SARS, MERS, many other things, Ebola, which have, of course, brought into question how these viruses impact national security, economic security, of course, social security. Do you think lessons were learned from the previous pandemics, from the previous epidemics, which made us better prepared for the new novel coronavirus?
And the short answer is yes, lessons were learned. And we as a global community, are doing things differently than before. The question is the response good enough? And that's a different discussion. But for example, compared to the SARS outbreak, there has been more increased, more sharing of information, quick interaction between countries, and sharing, the number of cases and reporting of cases, et cetera, with WHO and with the world. There is better coordination at the global level and within certain countries. There is better preparedness at the institutional level in several institutions and in several countries. The question is that does better equate with good enough? That's a different question, and that remains to be seen. But we as a global community are better prepared compared to the previous outbreaks.
Right. I have a number of questions to answer there. One of them is, of course, when you say that we are better prepared at institutional levels, which institutions are you exactly referring to, and which countries?
Well, unfortunately, most of the preparedness has been on high-income countries, but even in low and middle-income countries, they have been improved in terms of diagnostic capacity. In terms of, for example, in Africa, there is a new Centers for Disease Control that was established after the Ebola outbreak to make sure that there's a more concerted regional response. Even in Pakistan, I'm aware a few institutions have done these tabletop exercises to make sure that, for example, the hospitals are better able to care for a somewhat increase in the types of respiratory illnesses that are associated with these viruses, et cetera. So there has been that level of institutional preparedness. Unfortunately, a lot of the increase in preparedness has happened at the high-income country level, but that doesn't mean that low and middle-income countries haven't paid attention to some of these lessons.